Morning, everyone. Thought I'd pass on a couple of interesting items that occurred today. First of all, I don't listen to this radio station, but a lot of people do, and probably you do as well. It has a nice ad by one of our local healthcare institutions for services to their one of their specialty practices, such as I don't know, maybe just a wild guess, orthopedics. Anyway, they really want to streamline patients into getting really world class orthopedic consultations, and the folks that work there are absolutely fantastic. Please don't misunderstand me. But in the ad, they said, we're going to streamline. I'm kind of paraphrasing here a little bit. We're going to streamline you in to make sure you get the orthopedic consultation you deserve, and we're going to work with your primary care provider to make sure that all things insurance involved are taken care of. Well, I know what that means. That means that someone at the office, orthopedic office, is going to call up and say to the family medicine, the family physician staff, you need to get the prior authorization and the referral and all the insurance crap taken care of because, well, we just saw your patient and we're going to do X, Y, and Z, but you really need to do all the work, all the administrative stuff so that, we're on the up and up and so that we get paid. Well, now hold the phone here a minute. So you're not going to involve the patient's primary care physician or provider from the get-go. You're just going to have the patient show up to the office without having seen their family physician for whatever orthopedic complaint it might be, which could very well be handled non-operatively. You're going to just have them come in and do all your funky juju stuff. And then once you decide what is the clinically appropriate thing to do, which you can make an argument is or is not accurate, you're going to then turf all of the work to get the insurance authorization back to the family physician's office. Okay, well, I got a couple problems with this. Number one, that's kind of putting the cart before the horse. I think that the patient should be examined by their family physician first to determine if that's the most appropriate path of management to go. And it may be that they need an orthopedic consultation, or it may mean that they need to have, I don't know, an x-ray or maybe physical therapy or some osteopathic treatment or something a little more common sense and conservative. So that's number one. Number two, this orthopedic office is going to tie up the family physician's office staff to do all the bull crap that they should have done themselves, which means that the family physician staff is then going to be tied up and can't take care of their own patients. Well, that doesn't make any sense, particularly since we kind of have a problem with people getting in to see doctors. So that only really creates more of a problem than what already exists. Just something to think about. So the short story behind that is if you've got an orthopedic complaint, see your family doctor first. Maybe you need to have a consultation, maybe you don't. But at the very least, involve them in the process of management. Have a collaborative discussion with them before you just go off to some other specialty office. And to this particular health organization, I would think that since you're trying to be the preeminent healthcare organization in the state, that you'd actually advocate for that. Apparently not. Anyway, item number two. Local lab service, who provided us some pre-printed lab orders, which was very handy, by the way, and I really appreciate them working with us to provide very low cost and cost-effective lab services, suddenly decided that they're not going to run the labs on the patients that I drew yesterday and sent over to the lab. Well, the reason they're not going to draw the lab is that I did not handwrite my name on the lab requisition. Now, the important thing to keep in mind is that the lab requisition is already stamped with my name on it. My office name, my name, the office address, the office phone number, the fax number, my inseam, my neck size, my wrist size, all these things that they probably don't even really need. But the fact that I didn't take a pen and handwrite information that is already on the requisition sheet somehow gives them the liberty to say, maybe this really isn't Dr. Forbush who's ordering these labs. So we're not going to bother calling him. We're just not going to do the labs. How do we find out about this? Well, we found out by trying to look up the labs and saying, how come these labs aren't done? They've been very quick in the past about doing this. And then we find out that apparently the magic is in the pen. So to all of my colleagues out there, regardless of what pre-printed information is on the lab requisition sheet, please take the extra time to reduplicate that in handwriting. Now, as many of you know, doctors don't exactly have the best handwriting, so it doesn't really matter if it's legible or not. At least you've written something on that you can claim as your name. All right. Have a great day, guys.